Hello, everybody. My name is Lynch, and I'm here today in front of you to present my TED Talk, How to Achieve Outstanding Health. Health is a combination between our physical, our mental, and our social stability. Each factor is extremely important, and each factor affects the other. Here at Cardinal Newman and at other schools, we place a lot of emphasis on physical health. If you break a leg, you break an arm, you get a concussion, go to the doctor, and they'll help you. But our mental and our social health is often overlooked. And that's 2/3 of what makes up our overall health. And we should really be talking about that. And that's what I'm here to do today. First, we must understand that there are two main factors that affect our overall health, both one internal and one external. Our internal being our social relationships. Those relationships are the relationships we have with our family and with our friends, the relationships we form at school and at home. This is also the environment which we live in and which we grow up in. For example, as many of you know, I lived in Ireland for 7 years, and my sister was born there. From the day she was born, she was constantly ill. She had every lung disease there was out there because of the cold and damp environment. This is one of the deciding factors of why we decided to move to California and to the United States, was because she was constantly sick. And this environment not only took a toll on her physical health, but her mental and social. And today, she's thriving. The second main factor is an external factor, that being our physical well-being and our connection to our healthcare system. Our healthcare system is often overlooked as well, but is a very huge underlying factor in establishing our core health. First, I'd like to talk about our social health, and that includes looking at Maslow's hierarchy, which basically works like a ladder. If you need to climb up each rung before you can get to the top. I would assume everyone in here has met their basic physiological needs. You guys have air, food, and water. I also would assume everyone in here feels safe. You feel safe right now, and you feel safe at home. But the rung where everyone normally gets stuck is the love and belonging rung. The sense of intimacy we have with our family and friends, and the support that we gain from this intimacy. For example, during finals, which is a very stressful time, and unfortunately we all take finals, everyone would ask me, Caleb, are you stressed? And I would honestly have to say no. Yes, it's not because of the rigor of my classes, even though I do take various AP classes, but it's because I have the support of my family and friends. And I know that support will still be there, regardless of whether I fail the test or not. And this support gives me the self-esteem to do well in school, and the self-esteem to stand in front of you all here today and give this TED Talk. I would say that I'm reaching a point of self-actualization. Of course, no person is fully there and no person is perfect, but once we gain the support from our family and friends, we can begin to become confident in ourselves and be confident in who we are. Now, how many of you have read Tuesdays with Morrie? I'm assuming a good amount. It's a very popular book. But for those of you who haven't, I'll give a quick, short synopsis. It's about an old man named Morrie who's slowly dying. But one can argue he's extremely healthy because he's both mentally and socially stable. He has the unwavering support of his family and friends and feels at peace with who he is and what his legacy will be. And he came to realize this when he says, this is not what family's about. It's knowing that your family will be there watching out for you. Nothing can give you that. And that's true. Nothing can give you that. Money cannot buy you happiness, and money cannot buy you support from your family and your friends. Morrie realized this, and it's time for us to realize this. The support from our friendships, our parents, our teachers are necessary and integral in forming a healthy body. Now that we've talked a bit about the social aspect, I'd like to talk about the physical aspect, that being the healthcare system. Behind me, you can see a cartoon that depicts the American healthcare system as a rundown car and European healthcare system as a pristine building. And I'm not here today to talk about what I think about the two healthcare systems, but to talk about what they do for their citizens. American healthcare often has a drive for profit. Dr. Elizabeth Rosenthal states that it is way more profitable for a pharmaceutical company to create a lifetime of treatment than one single cure. And doctors lose a sense of connection with their patients. I speak both from personal experience. I have grandparents in Arizona who carry around garbage bags filled with pills and prescription drugs, and they've been through countless doctors. Whereas my grandparents in Ireland have been through one doctor after decades. This doctor has grown a sense of connection with them, has become closer with them, and is able to properly diagnose them. That's what's missing from our healthcare system today. Not a bunch of fancy technology, but a sense of connection with our physicians. And that's why I want to be a doctor. I want to be a doctor because I want to form a sense of connection with my patients, and I want to help diagnose them correctly and help them succeed, help them become more healthy, physically, mentally, and socially. Behind me, you'll see a graph which depicts healthcare systems rated in the world. The US healthcare system is the most expensive healthcare system in the world. Yet, as you can see, we're not getting the best care. And the simple answer to that is our connection. We do not have connection to our physicians, and that's what we need to work towards. Now, you can see 3 countries' flags behind me: Denmark, Norway, New Zealand. Consistently rated the 3 happiest countries in the world, and if you remember from the graph, all at the top of the graph, ahead of the US in healthcare. And we must ask why. We must ask why they're receiving better healthcare when their healthcare is free, yet we're paying millions. There's 2 simple answers. A, as I already stated, the connection with physicians, but it's the desire of both physicians and patients to help themselves. We must help ourselves in realizing that we need support and we can't rely on ourselves. Now, I'd like to leave you with one thing. From this talk, I hope that you got that health is divided into 3 sections, and you can't look at health as a whole. It's made of our physical, mental, and social state. Our physical being the connection with our healthcare system and our connection with our physicians, and our social and mental being the relationships we have with our family and friends. They are essential. And once we realize this, we can truly become mentally, socially, and physically healthy. Thank you.